Good morning and welcome to Health Talk on AM 1270 and 96.5 FM KXBX. My name is Paul Thomas. With me as usual in the studio is our good friend Bill Kearney of Northlake Medical Pharmacies. Bill, a little break in the weather and we're seeing a sunshiny day.
Yeah, perfect. I got back last week, after a couple of inches of rain, and then it started out again yesterday, and it rained all day, and then we've got rain coming up again. So, of course, all this has to do with destroying our roads the more rain we get. And I have a special guest with me this morning that's going to be talking about Measure Z for the city of Lakeport. And I want to emphasize that this is not necessarily the opinion from the radio station. This is Chief Brad Rasmussen's introduction to what Measure Z is for the city of Lakeport, and it gives me great pleasure to introduce a good friend of mine, an early Lake Lion, a Kiwanis, does a lot for this community, Chief Brad Rasmussen from the Chief Police Officer of the Lakeport PD. Brad, welcome.
Thank you, Bill, and good morning. Good morning, Paul.
Good morning.
Good morning, listeners. Yeah, I'm happy to be here today, and like Bill said, I'm going to discuss Measure Z, which has been placed on the ballot for voters in the city of Lakeport this November. I am the police chief in the city of Lakeport, but I do want to state that I am off duty today on my own time, so any opinions I may state are not stated from the city or the police department.
Well, we would take a lot of information, and the phone number is going to be 263-5252. We're going to take the first 15, 20 minutes of this radio show and discuss Measure Z, and it is to enhance our police department, and which has been excellent after we got all the positions filled, and to improve our roads. And I don't live in the city of Lakeport. I live in Kelseyville, but my businesses are in Lakeport, and I can't vote on this measure, but I certainly agree with what we're trying to explain here. So I'm going to turn it over to Brad and let him explain exactly what Measure Z is.
So what Measure Z is, it's titled the Lakeport Public Safety Essential City Services Measure, and it's to maintain and enhance general city services, including recruiting, hiring, retaining qualified police officers, to improve neighborhood patrols, maintain response to property, burglary, and violent crimes, and to pave and repair local streets and potholes. Also enhance business attraction and youth recreational programs, as well as keeping Lakeport's parks and pools safe and clean. So to do that, back in July, the City Council, after conducting a community survey, placed this measure on the ballot for November. And what it is, it's a 1 cent or 1% per dollar sales tax measure that would apply in the city of Lakeport. And I will note that it wouldn't apply to medications, prescription medications, or food purchased as groceries, so it wouldn't apply to those items. But it would be expected to bring in about $1.5 million additional dollars to the city of Lakeport general fund, which would then be used in those items that I stated under the measure. There's a lot of issues with the finances in the city right now. One of the big ones being that the sales tax incomes have not fully recovered from the recession going back to about 2008, 2009, and we've had significant amounts of state funding taken back by Sacramento that has impacted the city's ability to provide public safety services.
And Brad, part of that was the redevelopment funds, wasn't it, that we had started doing throughout the county, and I forget what year it was that those funds were withdrawn, because a lot of that covered what this 1 cent sales tax is going to achieve.
Yes, the city had redevelopment funds. I want to say it's probably been about 4, maybe going on 5 years now since changes in state law and procedure eliminated redevelopment. So the city lost significant amount of money in the area of redevelopment, and that impacted other services. So the only money they were able to keep on redevelopment was for projects that were already in the works, such as the Main Street project that you see right out here outside the radio station, which was the repaving and the widening of the sidewalks, which was redevelopment funding that was already dedicated towards that. So we didn't lose that, but we lost anything that would have been available for other projects.
Again, our number is 263-5252 if you have any questions to ask Brad. One of the questions that I had asked Brad before we commenced the program was, since this money goes into the general fund, how do we know that money is going to be protected for the uses that that tax was to be originally meant for?
Well, the accountability for this measure is written into the text of the ordinance if it passes, and that is that there would be a citizens advisory committee that would conduct annual audits of the funding and then advise the city council members how to spend this money. So if it does pass, the council would be looking for I believe it's a 5-member board that would advise them on how to properly use the money. And I believe that is important to people because it is a general fund measure, but the city, I believe, is committed to using this money for the items that are in there, such as the police enhancement, as well as the repairing and paving of streets, the business attraction, and keeping the parks and pool clean and safe. And it's called the Lakeport Public Safety Measure, but when you look at public safety in the big picture, it's not just police responding. It's, you need good roads, you need safe roads, you want your parks and pool to be safe and clean for the use of the public. That all, you want to enhance business. We want to attract more business, keep business in Lakeport, because that's vital to our economy. And when you put all that together and you work it together, I think it equals a safer city.
Well, I'm going to throw you a little curve now. I never thought about this until you were talking, but say the medical marijuana initiative passes. Is that going to require more police department as far as a greater amount of police officers to be able to handle the additional problems that might occur?
Well, that's a good question, Bill. It's kind of really hard to say right now, I think. And I believe you're talking about Proposition 64.
Correct.
I don't necessarily believe it would cause a need for or have significant impacts initially, because the cities and counties will still have the ability to regulate growing through land use provisions, such as we have an ordinance right now in the Lakeport that allows for cultivation of medical marijuana. It's been in place for a few years now, and prior to that ordinance being put in place, we had more issues with crime, such as violent burglaries of marijuana grows and that nature in the city. But we worked with a committee that included growers, city representatives, police, and fire to craft this ordinance that currently exists, that we believe has worked very well, and it significantly reduced complaints that we had regarding grows in the city. We think it's been working well, and the city still has the ability under the state medical marijuana changes that happened, I believe, about a year ago, where they still have the ability to regulate certain things to that nature. So it's a good question, but I think it's hard to answer right now how that will affect the city. But there are I do have concerns, but I can't really say right now how that's going to affect the overall picture.
Was the city council responsible for initiating this Measure Z to start with, or was it something the city requested, or how did that come about?
It came about when city staff was looking for ways to secure proper funding to carry out the safety programs that we feel we need to have in Lakeport. It was presented, information was presented to the city council. They then decided that it should be explored and directed city staff to conduct a community survey, have a community survey conducted regarding voters' thoughts on a measure such as this. And we actually presented different amounts, such as a half cent or a 1 cent, and I believe down to a quarter cent they presented. And the survey from the community, which was a sampling of voters, came out, I think, close to 70% in favor of the 1 cent amount. And then once that information came in, the council reviewed everything and decided that it was appropriate to place this on the ballot.
Once again, our number is 263-5252. If you would like to ask Chief Rasmussen any details about this. I have a two-part question, Brad, and one is, now if I could remember the second part, one is there an expiration date on this tax if it is passed? And number two is how soon would those funds be available if it did pass?
For the first question, there is no expiration date. What's written into the measure is until ended by the voters. So it would be a voter action to end it at any time they believed that to be appropriate. It would have to be placed back on the ballot by the voters to end it. The second part is I believe 120 days, or the next quarter available in the state tax cycle, which would be about 120 days from the date of the election. If it passed, the money would start being collected.
I think in the past we've had several different initiatives on the ballot that involved Lake County and Lakeport, and one of the ones that I keep remembering is the Save the Lake, and we put it on the ballot twice and it didn't pass. But there's a difference in this law as far as the percentage of votes that it takes to pass this proposition. Would you explain that, please?
That's correct. This measure was placed as a general fund tax measure, so it requires over 50% of the voters for it to pass. The Save the Lake measure that you mentioned and some others, and I believe the measure that's currently on the ballot in the city of Clear Lake, Measure V for their roads, those were basically a supermajority, over 66% of the voters to pass those. Now, what that means is that those monies would go into a specific account just for those items and could not be used for any other general fund purpose, which the City Council has the authority over spending of the general fund where they believe it's necessary in the budget.
You said there's a citizens advisory group that would monitor this. Is that part of the measure to make sure that occurs?
Yes, it is. It's written into the text of the ordinance, and if people want to read further information, the complete text of the ordinance is how it would read if this passes. They can go to www.cityoflakeport.com, look on the front page on the left, and see on the top under Hot Topics Measure Z. They can open that, and there's links with additional information, one of them being the ordinance, which describes that information.
I just got a garbage bill from the city, and I think this was with it, called the City Watch City of Lakeport newsletter, and it has quite a bit of explanation on Measure Z. I don't know who this goes to or exactly where it come from, but it's a very good synopsis of what Measure Z is. So if I get, if it came with the the garbage bill or the city pickup. I don't know how it was sent out, but
I have my copy of that also today, Bill, and that it had a Chief's Corner in it that had information on Measure Z. But basically, it's the City Watch, City of Lakeport newsletter that goes out approximately every quarter, and it's mailed to every resident and business who has a utility account, water account, garbage account with the City of Lakeport. So every residence, every business in the City of Lakeport should have received this City Watch, City of Lakeport newsletter.
well, it's very informational and very well done. So when I was asking you to email me some information about the measure, I got this, and I thought, gee, this is pretty concise, and plus it has information on the construction updates and those kind of things. Again, our number is 263-5252. If you have any questions, we'll be here about 5 more minutes, and would love to. I do this show every week, Brad, and we always mention that please call in, and very seldom do we have people call in, and then when I get off the air and I get into my store, they're calling me on the telephone and asking me questions. So we were hoping to avoid that happening down at the police station.
Right.
But
Well, I mean, I'd welcome calls from anybody either on the air or off the air if they had questions. They can also, call the clerk's office at the City of Lakeport and ask any questions they want. That information is described on that website I stated. So there are plenty of folks they could talk to regarding questions about this measure. I did have a couple other points about it.
Go ahead. Sure.
Yeah. So one of the things I wanted to mention is that, like I said, the city revenues have gone down, and with regard to the police department, we actually were staffed up until 2009 with 14 sworn full-time police officers for the city's jurisdiction. We were severely cut with the economy and the redevelopment issues to the point where we went down from 14 to 9 full-time sworn police officers. We have now gotten back up to a total of 13 sworn, 12 being dedicated to the city, and now 1 working exclusively at the Lakeport Unified School District. And that's been an important program to me over the years in trying to get an officer back at the school. We had federal grants for it in the past, which ran out, and but this year we were able to work with the school district, and they're paying about 90% of that position. So it's now dedicated to just protecting the school. So we have an officer over there full time at the school. Also, people ask a lot of questions about the roads, and we still do have roads that are not in good condition. But the thing is, it's very expensive to redo roads. Upwards of $1 million per mile. We have 31 miles of roads in Lakeport, and so it's hard to come up with money. Since 2004, the city has spent about $12 million on roads, and we still have a lot of work to do. If you look at we just repaved Bevins Street. That one was done with about 3 years of highway safety or highway user tax money that the city gets from the state, and it took about 3 years of savings to do just Bevins, just under a half mile, at a little over $400,000.
Well, in all the years I've been doing this radio station, which I think is this radio show, which is about 30, I've never had the chief of police offer his time to come and speak about anything. I'm telling you, Brad's not even looking this stuff up as he quotes it. He has all these figures in his head. He's a deeply concerned citizen and resident of Lakeport and of this county. He's been on Special Olympics. I broke my leg last year, and he was walking me in the lake with.
I remember that.
With freezing to death, and I had a cane, and he was right there by my side. So we're extremely honored to have you here, and would hope that this benefits the city of Lakeport and benefits you for the police department, and of course the roads and ways for us to utilize that Measure 1. So. Thanks for taking your time out, Brad. I appreciate it, and you're welcome anytime. So.
Thank you. I appreciate being here. Thank you.
Thank you. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. I'm sure you've seen and heard the recent advertising from the pharmacy chains in the area telling you about a special price for their generic prescriptions. And if you've been a customer of an independent community pharmacy and you've probably wondered if you could have to change to a chain pharmacy to get a special price on your generic prescriptions, the answer to that is no. Northlake Medical Pharmacies, in conjunction with Good Neighbor Pharmacy, has their own prescription card savings plan. From an inventory of over 300 generic prescription medications, you may purchase a 30-day supply for only $4.99 and a 90-day supply for $10.99. There's a one-time charge that will be charged off your first prescription, and that is the fee to enroll you in our program. So whether you're a brand new patient, Medicare D patient, or just a cash customer that has no insurance plan, come see us at Northlake Medical Pharmacies on Hill Road next to Sutter Lakeside Hospital or outside the Bruno's Shop Smart at 347 Lakeport Boulevard.
America had just gone to war when Felipe Adams volunteered.
I knew what I was signing up for. I knew the consequences. I took a bullet to the side and left me paralyzed.
For Armando de la Rosa, the Navy was a chance to serve and see the world.
I got medically discharged in 2001.
Armando and Felipe were brought together by a unique organization that serves our paralyzed veterans.
If there was no PVA, it'd be a lot of confusion. Our training is to better the veteran. We help out with the auto grant, the special housing adaptation grant, education, prosthetics. Our main focus is spinal cord injury and disease, but we see anybody.
First thing he had asked me before he even asked my name was I being taken care of as a veteran? And I thought that was pretty good.
Changing lives, building futures. That's Paralyzed Veterans of America. To learn more, visit pva.org.
A few years ago, I noticed my vision getting blurry. I thought it was part of getting older, but I was wrong. I have a disease called age-related macular degeneration, or AMD. It's the leading cause of blindness in people 55 and older. There are treatments for AMD, but early detection is key to saving your sight. To receive a free AMD packet, call the Foundation Fighting Blindness at 800-585-0516. That's 800-585-0516. You'll be glad you did.
In the last decade, more than 400,000 people died on America's roadways. That's one person every 13 minutes. Roadway deaths strike the young or old at any time of the year, at any hour of the day or night. And it doesn't matter whether you drive a car on a highway, ride a motorcycle or bicycle on a country road, or simply take a walk near traffic. Everyone is at risk. Since 1969, members of the American Traffic Safety Services Association have worked diligently to make our nation's roadways safer by providing the majority of roadway safety features, including bright signs and pavement markings, guardrails, and crash cushions. These are just some of the roadway devices that save thousands of lives each day. Since most of our roadways were built in the 1950s, there's so much more work that needs to be done to reach the ultimate goal of zero deaths. Safer roads save lives. To learn how you can get involved, visit atssa.com. A public service message from the American Traffic Safety Services Association.
It's not bad. All right, welcome back.
Well, we're back now talking about health. So
Health.
we just had Chief Brad Rasmussen speaking about Measure Z that's on the Lakeport ballot. And I know a lot of you don't live in Lakeport but do shop in Lakeport, and I appreciate you letting us take the time to take care of some things that affect where our businesses are, if nothing else. So we got a lot to cram in here, so we'll just do some highlights. One of the things that really got my attention yesterday, and I wasn't planning on talking about it, and it was a headline of the brain changes that are seen in kids after one season of football. And I have grandkids that play football, and I'm sure a lot of you do too, and some of you, it's your kids, but we're seeing some associations between the amount of change in the brain and the amount of exposure to head impacts. Now, I played football from the time I was in junior high to a few years in college, and then again in the military. And I got hit a lot. I was a guard. I was a pulling guard. Football is a very physical sport, so there's a lot of changes in the body after a season of football. I mean, you have cuts and bruises and torn ligaments, and most of those things go away. But what we're seeing now is just another one of those physical manifestations of playing a season of football that won't go away. And that involves nearly 3 million youth players who participate in tackle football programs across the United States. And there are about 2,000 active National Football League players. And all the time you see the results of a concussion. There was just, this has nothing to do with this article, but there was a thing on Microsoft News yesterday where a goalie in a hockey game or a soccer game, one of the two, got hit in the head. And he was unconscious for 3 days. And when he recovered, he was speaking a whole different language.
What?
He was fluent in in Spanish, and although Spanish was spoken around him, he spoke fluent English. So the brains of youth and high school football players are still developing. When they were, I remember when I first became a lineman, we would, and even in college, they would have us at night look up to the floodlights and start walking, and then somebody would run and hit us as hard as they could. You couldn't see them. You had to have your head up looking, and they would hit you as hard as you could and knock you down.
Lovely.
So the one thing about this is, and I,
Wow.
one of the things that I'm thinking about is maybe that's why my pain threshold is so high, because those things didn't bother me at the time. And this research is quite small, but it was significant enough that I just wanted to mention it. They recruited 25 participants from a local youth football team between 2012 and 13. In the very beginning, they had an advanced MRI on their brain. They also were provided helmets embedded with sensors that measured the severity of every hit to the head. And none of the players suffered a concussion during the season at play. At the end, they underwent a second MRI, and they compared the two scans to track changes in the brain. And they also evaluated the head impact for each player to see if there was any connection between the hits they took and changes observed in their brain. What they concluded was players with more exposure to head impacts displayed more changes in the white matter in the brain, and that's composed of millions of nerve fibers that act like little communication cables, like wires that go into a phone jack or something. We don't know what that means, and we don't have an answer yet. So the study results are consistent with previous studies and the tools used by researchers. A big strength of this study has very quantitative measures that can essentially count the magnitude, the size, and the number of impacts. There has to be more studies. There are some evidence that a cumulative impact, regardless of whether you had a concussion or not, might be a problem. I'm not saying I never had a concussion, and I've had several since I quit playing football, but those were all related to something stupid like falling down a stairway. Or so I wouldn't want to make a conclusion about every kid playing football on the basis of only 25 kids. If the results are driven by one or two individuals in the study, you can't really tell. But the new results come from two of a 5-year study, and the researchers will continue to track some of these players. So there's a lot of additional questions we need to ask. Do they linger? Do they go away? Do they have a long-term consequence? And like I said, not one of these individuals had a concussion after we took those MRIs from them. So it would be even worse, I'm sure, if there had been a concussion. We don't see that normally in kids taking they're much younger because they don't hit as hard. But now kids are getting stronger. They're preparing for even Little League football and working out and becoming a lot more muscular. So there's always a chance that that can happen at a more increased frequency than it had in the past. We got an election coming up, and the election has to do, it's November the 8th, it has a lot to do with health care as well as everything else. And I'm sure you've read the news that There's a sharp rise in Obamacare premiums for 2017.
Yeah, like 24% or something like that.
Prices of health plans sold under the Affordable Care Act are rising by double-digit rates. This announcement came Monday on the brink of a presidential election that may help determine the future of private health insurance. Open enrollment in Obamacare, not just Medicare D, starts November 1st. So buyers who use the federal insurance marketplace called healthcare.gov can expect rates for silver plans to rise 25%. Benchmark plans are the second lowest cost silver health plans in the marketplace. Those plans are used to determine tax credits available. So overall, Department of Health Services estimates an average of 22% increase across the states for 2017. And the District of Columbia, as well as 39 states. So the average consumer that's shopping for coverage on healthcare.gov will have a choice of health plans from only 3 insurers. However, roughly 1 in 5, there will be only one insurer. Now, when you only have one insurer to choose from, you can imagine how high the rates are going to be because there's no longer any competition. I just want to talk about one thing. As you hear the candidates talk, you hear them talk about the high cost of prescription coverage, of prescription drugs. For God's sake, do not let somebody tell you that you have to go to mail order or you have to go to a chain pharmacy because the cost of the drug is less. We are making cents. The average net profit in community pharmacy right now is 2.3%, with a very high cost of payroll because of the professional people that they have to be surrounded with. So in 2014, when they began the high-speed enrollees, they flocked into the program. 2017 enrollment growth is small, and it will perpetuate market instability. So younger, healthier participants are needed to get in the Affordable Care Act. They can't afford to get in the Affordable Care Act. But if they start costing the reimbursement to pharmacy providers anymore, we will not be in existence. That's not where the high cost is coming from. It's coming from specialty drugs, which are used for, we've talked about this on the radio station before, taking 2 drugs that are generic, ibuprofen and famotidine, which is Motrin and Pepcid together at a strength that's not available commercially, and making it into a pill. And instead of costing $25 for the 2 of them for a month, or $10 or $15, it's $2,300 for a 30-day supply. And the PBMs are going along with it, the pharmacy benefit managers, and paying that kind of a price. And they're reducing the amount of reimbursement they're giving the pharmacies that actually dispense it. So, you know, if they cut the providers much more, there will not be any providers locally, that, including chains, that are able to do that. So just letting you know, as healthcare continues to escalate in price, and the medicines continue to escalate in price, they are going to try to force you into a system that pharmacies no longer exist. So you need to make sure that you're well aware of that as you try to sign up for a healthcare plan. Lots of people, it seems like more than ever now, have a heart arrhythmia, and they're checking heart arrhythmias more than they ever had before. And a lot of people are going on medications because they have a skip in their heartbeat. People with an abnormal heart rhythm, and this is called AFib, you've heard doctors talk about it all the time. Many of them take really powerful blood thinners to prevent strokes. It used to be it was Coumadin, warfarin, and then they came out with non-Coumadin type AFib drugs that were very, very expensive and had side effects, or they put in pacemakers or defibrillators. So, but those who suffered only short bouts of AFib estimated at 20 seconds at less, were at no more risk for stroke or other heart complications than people without AFib. Well, what we started to do, because we didn't want to risk anything happening to you, is put everybody that had AFib on some kind of medication. If it was warfarin or Coumadin, you had to take a INR test or a ProTime test every week, and they would adjust the Coumadin to what you ate, how much you exercised, what kinds of foods that were being processed within your system, and an additional cost, of course, to go to the hospital every week or at least every month to have that. Then they came out with Pradaxa, and they came out with some other Eliquis and drugs that are $400 for a month's supply, and you don't have to take a test. But you pay a tremendous amount of money, and a lot of the insurance companies are taking those drugs off the formulary, so you're left without an explanation on why you have to take it. If you're one of the kinds of people that has just a short episode that lasts 15 to 20 seconds and you're really low risk, that should not trigger the use of anticoagulants. Now, I know that a lot of you are in that category, and you're going to go to the doctor and say, well, I just heard Bill Kearney say that we really don't need to be on anticoagulants if this happens a few times a year and they only last for 15 or 20 seconds. But starting a patient on blood thinner also depends on several factors, not just the length of the AFib. They include the age, the gender, and whether they have other conditions such as heart failure or high blood pressure or diabetes. More frequent episodes or even a short duration of AFib still may be a concerning development if you have some of those secondary conditions. Much the same way as one high blood pressure reading does not automatically say that you have high blood pressure. The decision needs to be sorted out with the trend. So the most common abnormal heart rhythm condition affects about 3 million Americans. People who have prolonged episodes have an increased risk for those heart complications, and the guidelines recommend that patients with AFib take blood thinners to reduce their stroke risk. So this was a big study, 37,000 EKGs, a test that graphs the heart rhythm. I'm sure most of you that are on something for AFib or been diagnosed with AFib have certainly had many EKGs. From 5,000 patients over 2 years, and all of them took part in the RATE registry, which is an ongoing study that follows patients with pacemakers or defibrillators. While those with long episodes were more likely to be hospitalized or die without the condition, those with short episodes were not more likely to be hospitalized or die, and that's what the study found. So more information is going to be forthcoming about this. It just seemed to be 10 years ago, we didn't hear much about AFib, and if it was somebody who had open heart surgery, or they had stents put in or something like that, and then they went with defibrillators or pacemakers. When I first came up here in 1980, a lot of people were getting coronary bypass. They were having 3 and 4 bypasses put in. And then they found out they were overdoing that, and instead of having a specific cardiac surgeon or cardiologist determine that you needed to have a coronary bypass, they would put it in front of a board of cardiologists, and they would decide whether or not that maybe you could do something less severe, like putting in a stent. And then they medicated the stents, and they had a much better result. And they cut down on open heart surgery considerably. But many times they just put in a pacemaker, and they did it right here at Sutter. They didn't have to be down at St. Helena or CPMC or one of those places. Now we hear about people younger and younger having AFib and seeing them be put on medications. If I was a practitioner, if I was a physician, depending on the other kind of secondary conditions a patient might have, I might be inclined to do that for a while. especially if they'd had some kind of a surgical procedure, and it would take a year to get them back where they were before, then I would probably, as a physician, certainly spend some time evaluating that and deciding whether or not I thought it was a good risk or not, and maybe just for a year afterwards. And that's kind of what these non-warfarin type of medications were for. And then they would put people on aspirin and low-strength aspirin and maybe a non-warfarin type of a anticoagulant, and people took it the rest of their lives. They found out that the risk was greater if they took them off that medication than it would have been if they'd left them on, and of course nobody wants to see these things continue on and be part of your life, and nobody wants to take 6 or 7 medications the rest of their life if they don't need it. So we'll kind of see what happens. People are more and more aware now of their health and what in fact they have to do to stay healthy, and realize that they have options. And when you have options, then one of those is not taking any more medication. So want to remind you that we're giving flu shots. We're doing it at senior centers in Kelseyville and Lakeport. My other store up by the hospital is doing those, I think, November 8th and November 10th or something. It was in the Record B today, the times for those, and we'll be helping them along the way. We're doing some at the offices of some of the businesses in Lakeport this week and next week. So if not, just come into the pharmacy, get your flu shot. You don't need to make an appointment. And we also, if you're over 60 and you haven't had your second pneumonia shot, we'll give you a pneumonia shot at the same time. Your Medicare pays for that. You don't have to worry about the cost of either one of those drugs.
And if you have a corporate insurance or insurance through your work, and you need a shingle shot, and you're over the age of 60, that is something that is covered for a lot of people, and a lot of people it isn't, and it's pretty pricey if you have to pay for it. But we give a whole multitude of shots, including tetanus. You step on a nail and you don't want to make a doctor's appointment, and you just know that you need a tetanus shot. Come in. I'm allowed to prescribe those as a certified immunizer, and so are all my pharmacists. Excuse me. I'm gonna go over 7 things you need to know about what you're doing with your prescriptions. And number 1 is we can protect your privacy. A doctor called to tell us the patient had been diagnosed with an STD, a sexually transmitted disease, that both him and his fiancée would have to pick up their medication. So we want it to be as discreet as possible when that happens. So we talk to them individually in a consultation room. television all the time now, and half of them say you're gonna die if you use this, and they have to say some of those things, and some of them are very misleading. There's one involved that is very, very expensive, and they're telling you at the very end of that spiel about the drug, this could give you 3 to 4 weeks more quality of lifetime. And you're gonna spend $10,000 for this drug, and you're only gonna get 3 to 4 more weeks out of it. You need to make sure that you talk to your pharmacist and physician before you go to that point. It's not worth if you have stage 4 terminal cancer and you have a limited amount of time left, or do you want to spend that kind of money to get another month? So don't be afraid to talk to your doctor, don't be afraid to talk to your pharmacist too. We're a lot more reliable than the web, so a lot of people go on the web before they treat themselves, and you just need to talk to somebody that can't benefit specifically from what you're doing. So if you don't understand those drug addicts, come in and ask us. One of the things that we have is HIPAA, where it's a Health Insurance Privacy and Portability Act, and you need to make sure that all your staff buys into that, and they're not talking about your medication to somebody else, or a friend of theirs, or about a physician, or about potential interactions on the medications. So sometimes we have to let people go if we find out that's happening, and we have to ensure your privacy. I'm on a board of directors, as many of you know, and I was called yesterday by the chairman of the board of my co-op, who's in Chicago, and he wanted me to call a potential applicant to be in 4 of the Yelp reviews were how obnoxious his staff was treating the customers. And I'm gonna have to call him today and ask him why those reviews. I mean, if you know anything about Yelp, you can't get them off of there. You're kind of screwed if that happens. But to see it repetitively in 3 of the 4 reviews was something that he should have gotten rid of that individual that was causing the problem. One time a family member came in and said that she was nervous to talk about whatever's bothering her. We told her to be able to feel not embarrassed. We talked to her about it. It happened to be a sexual issue or something that was irritating her, and we took her into the consultation room and talked to her about it. We're healthcare professionals. We deal with this all the time. And don't be embarrassed to talk to your pharmacist about that, and maybe you were using it incorrectly. We compound a lot of hormone replacement therapies, and sometimes we use bases that maybe aren't very gentle to the mucous membranes, and we can change those bases if we get feedback from you. So don't be afraid to, even if it's a male pharmacist and it's a female problem, we're certainly above discriminating against anything like that, and our goal is to make the medicine more effective and not have side effects that affect you so much that you can't handle it, so don't be afraid to talk to us about anything. Another thing that you need to know is if you drop your pills and you're going to be short until your next refill, we can give you a 72-hour supply to get you through without consulting with the doctor, and then we'll follow up with the doctor and do that. So, unfortunately, most most of the stories we have on spilled pills are controlled substances. They rarely take your blood pressure pills. They rarely take your thyroid pills. They rarely take any maintenance medications for diabetes. What they seem to always report is somebody took my Norco, somebody took my Soma, somebody took my Ativan. Unfortunately, those are the kind of drugs that we see a pattern of abuse with, and not always can we give you a couple of those to get you by, because the DEA checks us and tells us that we can't do that. There's a sign of abuse. We can run a report through the Department of Justice in California and come up with where you're getting these medications someplace else also. Last week we refused to fill two separate prescriptions from two different individuals. And we spent an hour and a half on the phone trying to get those medications okayed, and we found out that they were going to multiple pharmacies and getting duplicates, and one pharmacy didn't know about the other. If we'd have filled them and the DEA had found out about it, the Drug Enforcement Agency, we would have been in trouble. Lots of times pharmacies can save you a trip to the doctor. Most pharmacies offer more than just the flu shot. You can receive a vaccination from almost any illness. A lot of pharmacies, sometimes without an appointment, such as ours, we're allowed to carry many different vaccines, and they vary from state to state. But hepatitis, meningitis, hepatitis A and B, tetanus, twice this week or last week I had people come in that stepped on a nail and needed a tetanus shot, and I had somebody yesterday that I was giving a flu shot to, an elderly lady, and I said, we also can give you that second pneumonia shot if you haven't had it. And I said, check with your physician and make sure. And she said, well, I'd rather go to you and get the shot and not have to pay for an office visit. And people don't want to go in to see a physician because there's a charge for them, or they don't think about it. So we bring it up, and you'll go into a lot of physicians' offices now, and they will bring it up, and they're very good about being proactive on whether you need a shot. We got into the immunization process when the bird flu came around, and they needed a lot of pharmacists to give shots so everybody would be protected. So, this wasn't something we were out looking for, but once we got entrenched in doing it, we've continued to add to what we do. And the last thing is about over-the-counter drugs. People tend to think that those pain relievers like acetaminophen and ibuprofen are harmless. You have to be very careful about mixing them with prescription drugs because, for example, if you're taking Norco, which has acetaminophen in it, or Percocet, and then you're getting acetaminophen or extra-strength Tylenol over the counter, or you go have a tooth pulled and you're getting one for chronic pain, and now the doctor that pulled your tooth is giving you another dose. And we have a lot of doctors that tell you to rotate between two pain relievers. Take ibuprofen here, which actually treats it, and then take the acetaminophen. Well, I'd like to remind you we're Northlake Medical Pharmacies with two locations for you. At 5136 Road East, across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul. Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk at 10 a.m. right here on AM 1270 at 96.5 FM KXBX Lakeport. Hi, I'm Bill Curry from North Lake Medical Pharmacies, and recently I spent some time with some of the students in Mrs. Goodwin's third grade class at Lakeport Elementary School to discuss the importance of taking vitamins. I asked the students, why is it important to take your vitamins, and here's what they had to say.